COVID-19 എന്ന മഹാമാരി ഈ ലോകത്തെ കീഴ്പ്പെടുത്തിയപ്പോൾ പടർന്നു പകർന്നത് സ്ട്രെസ്, ഡിപ്രഷൻ, ആങ്സൈറ്റി, isolation. Kmcc and TLM proudly presents this exclusive webinar for stress management during COVID-19. Darkness erased, all tunnels have a light at the end. It is with immense pride and pleasure I warmly welcome our guests of honor and guest speakers. Mrs. Subaida Valiya Mannathal Hanifa, a visionary leader, clinician, Ontario Network of Child and Adolescent Inpatient Psychiatry Services, an active global volunteer. And alongside we have our other guest speaker, Mr. Muhammed Kurikkal, Clinical Manager, Psychiatric Emergency Services Unit, PESU, Urgent Care Clinic, UCC, Assertive Community Treatment, Impact. I warmly welcome both of you on board and hand over this panel to our guest speakers. Subaida ma'am.
Sorry guys, we can't hear.
Thank you for joining us today. We help people to overcome stress and lead amazing lives. Today, we're going to show you how to do that. We have 3 easy to use tools for you to take home, so something for you to work with. We'll talk about that further in the session. The topic may bring up a number of questions from you, and we want to let you know that we will address as many as we can in the time we have today. With that, we're going to start our session, but Muhammad reminded me to tell you that parking is free today, so you don't have to pay for parking. But remember to keep the distance and stay connected. Here we are. Okay, can everybody hear me and see the slide and all that? It's okay?
Yes, it's good.
Thank you. So we're going to get to the first slide here. So what are we going to do today? Like I can summarize what can you expect, what we're going to do today. We're going to talk about some of the challenges that are faced by the international, specifically for international students and newcomers. But a lot of the material that we're going to cover can be applied to many other people attending the conference today. We have a multi-faith, multi-cultural, multi-country people attending. So it's sometimes some of the tips and not the tips, some of the resources that we provide may not be universal, but we will come to that when we talk about that and say how you locate your own resources in your own community, how to access emergency services when you need it. We also will identify, we talk about stress a little bit, what is stress and what are the symptoms of stress and how can you identify them. Then we'll talk about some of the tools that I talked to you about and then some tips how to manage your stress. And we'll talk about some of the resources that we have and the information. And we'll also talk about how to create some safety plans for you and when you access, how to access the emergency and services. With that, this is the slide, like I thought it would maybe give you some perspective on international students. I move my slide over here a little bit. Sorry about that. Okay, so this is the stat I got from the Global Affairs Canada or Canadian Immigration, Refugees and Citizenship Canada. It shows the number of students. I think my screen is kind of covering up my presentation. Okay, there, got it. Sorry about that, some technicality here. you go, Ken. So it saw the total of 642,480 international students, a 13% increase that we saw from the previous year. So obviously, like, the international students coming to Canada are increasing, which is really good for Canada and for India and the students coming. And actually in 2018, Global Affairs Canada, reporting 721,000 students. Now that's not just Indian students, like they're all over. Now this slide will show you, the enrollment of students like from India. So specifically to India, international students entering, in our university, like in Canada, in colleges. Interestingly, you can see that in the next slide. Earlier on, the university entrances were higher than the college entrances. And then we'll see also the volume had gone up, and there's quite a bit like, jump when you look at 2016 and 17. I didn't have a graph for the 2018 and 19, but you can see the trend. It's like really going up all the time. But for some reason, more increase in enrollment in the colleges. So here's the data always gives us some insight. And you can see India is at the top there for reporting, like, see how many, this is the census in 2016. They ask about, where you were born in, one of the questions in the census, and that's where we get that data from. And that can be available to you too. And you can see China as the second one, and Philippines and Pakistan and Iran next. And also when you look at here, India again ranked first. This is the Ontario one, and there's a 10 source of countries, and then you can look at it like, again, that we have a lot of students and refugees and immigrants coming to the country. So let's move on to the next. There are different categories of immigration. The economic immigrants are 54%, and family sponsored used to be higher, I thought, like some of the stats, but now this is what we see in the last 5 years, 32%, and refugees and other immigrants. I don't want to focus too much on stats, but want to give you some perspective on the international students and the immigration to Canada. Now, this is the latest one. Like, I was reading Forbes magazine, and they also reported this data. This is pretty recent, February 2020. And you look at that increase, the increase in the permanent residents in Canada. It's from 39,340 in 2006, a huge jump to 80,685 in 2019. Through the first 11 months, it's not even that year completed. So it's really, really going up in numbers. What does that mean is, like, we have to kind of be ready to help people who want to come here to study in Canada, and also to settle down here as resident. So that's where we're going to look at, like, and how this is going to benefit our people, people in Canada, people in India, and also our economy, both economy. Now, focusing on a COVID. ഇത് പറഞ്ഞാൽ ഇവിടെ വരുമ്പോൾ കുറച്ച് മലയാളത്തിലും പറയാം, ഇംഗ്ലീഷിലും ഞങ്ങൾ മാറ്റി മാറ്റി പറയുന്നുണ്ട് കേട്ടോ. പിന്നെ അപ്പോൾ ഈ COVID-19 എന്ന് പറഞ്ഞാൽ നമ്മൾ കൂനുമ കുരു എന്ന് പറഞ്ഞ പോലെയാണ് ഈ പുതിയ സ്റ്റുഡൻസിനും പുതിയ ഇമിഗ്രൻസിനും പറ്റിയിരിക്കുന്നത്. We all agree that നമ്മളെ ലൈഫെല്ലാം വളരെ ഒരുപാട് ചേഞ്ച് ചെയ്തു ഈ COVID-19. There was no argument about it. Like, we hear that, like, anywhere we look at, like, the news is like, all about Corona, how to, they're teaching us how to change our habits, like as if we didn't know how to wash our hands. Now we want to learn how to wash our hands, how to sneeze, how to cough, wear your mask. I'm not going to focus on those kind of things, because we see that a lot now, which is very important. We need to keep on focusing on those things. But what is missing and dear to our heart, like for Muhammed and me, when we look at the frontline news, one critical issue is missing, which is mental health. Not totally missing, the people starting to address it. And I was looking at the data, because COVID-19 is so new, not a lot of studies had done, but some employers had studied, their employees, how they're dealing with the stress of COVID COVID-19, and it's definitely showing some serious challenges related to depression, anxiety, and emotional exhaustion. And that is affecting people's lives, of course. And no surprise to you and me, and we know that that's happening. And again, the specific challenges, nobody wanted to get COVID because we hear horror stories and there's all kinds of stuff happening, and we hear deaths, and it's pretty challenging times, right? And the financial pressure, we don't need to talk about it. A lot of people are losing jobs. I have a lady that called me and says, my son finally got a full-time job in a company, and now the company is closing, and I don't know what to do, and my daughter is supposed to get married. That's all. So it affected people in so many different ways, and I don't need to go into details because you all out there hearing about it and going through it. COVID is not restricted to one country now. We all have, some of us have more and some of us has less of COVID blessings. So and the job security, again, we don't need to, like that's also affected. And that's, again, it's very challenging for the international students because they're hoping the money that they brought is limited, and they were hoping that they could do some work, and they do have some work permits for, the limited hours to work. And so that money is like, scarce. So their living condition and their food, all that is going to be affected, how they're going to spend. And emotionally, everybody's exhausted. And it affects more for the international students and the newcomers. The others have, at least we have some saved up money that we can kind of hang on to it a little longer. So those are some of the specific ones. Now, this slide, I kind of laugh about it when I hear about the Canadian weather. A lot of people say, what's that Canada like? It's cold, but some people say, we like cold, we like the snow. They're thinking about the Bollywood romance, like rolling down the, hill in the snow. But when you come here, then you realize it, oh my gosh, this is what the Canadian weather is like. But you will learn the Mollywood, Malayali, you kind of learn to live with it because you will start then making the snowman, and we'll talk about that. Because initially it is a shock, what can you do? Muhammad and I earlier talked about it. We went to Kerala, Kurikkal പോയപ്പം കുട്ടികൾ പറഞ്ഞ് അമ്മായി നിങ്ങൾക്ക് പിന്നെ ഐസ് കാണണമെന്ന് ചോദിച്ചു. What? I thought, I didn't know what they meant. Ice, I thought maybe something different, and really they were talking about ice. And I'm from Canada, and I said, okay, everybody goes to the Highlight Mall and want to see the ice. And he said, oh, you really feel cold when you go in there. And I said, okay. So we had a chuckle about that. And so that's one challenging stuff for people. It also keeps us home sometimes because we don't want to go out when it's cold. And so we have to learn how to tackle those kind of things, right? And language is another issue. Although people, many of you spoke English when they came, but it's still the accent, and the communication is huge. And so when you go for interviews and when you go into the classroom and they're teaching you, അതെല്ലാം പഠിക്കാൻ പല ലാംഗ്വേജ് ചില വാക്കുകൾ നമുക്ക് പെട്ടെന്ന് കിട്ടിയെന്ന് വരില്ല. പിന്നെ ചിലർ പറയും ഒന്ന് റിപ്പീറ്റ് ചെയ്യൂ, നിങ്ങൾ പറഞ്ഞാൽ എനിക്ക് മനസ്സിലായില്ല, ദെൻ അപ്പം നമുക്ക് ഓൾറെഡി ഫീലിംഗ് ബാഡ് അബൌട്ട് ഇല്ല, ഒന്നും കൂടെ റിപ്പീറ്റ് ചെയ്യണമല്ലോ എന്ന് ഇങ്ങനെ തോന്നും. അങ്ങനെ it's extremely challenging, especially when you're dealing with ഒരുപാട് other stresses ഉള്ളപ്പോൾ. അതേപോലെ എഡ്യൂക്കേഷൻ സിസ്റ്റം രണ്ട് തരത്തിൽ ഞാൻ നോക്കിയിട്ടുണ്ട്. ഒന്നാമത് ഇത് പോസ്റ്റ് സെക്കൻഡറി എഡ്യൂക്കേഷനാണ് കുട്ടികൾ വരുന്നത് കൂടുതലും. അപ്പോൾ വരുമ്പോഴേക്കും നമ്മൾ പിന്നെ ഓൾറെഡി ഹൈസ്കൂൾ വരെയൊക്കെ നമ്മളെ നാട്ടിൽ ഞാനൊക്കെ പഠിച്ച കാലത്ത് ടീച്ചേഴ്സ് ഡു എ ലോട്ട് ഓഫ് വർക്ക്, നോട്ട്സ് ഒക്കെ തരും, മോർ ലൈക്ക് എ ഡിപ്പെൻഡൻറ്റ് കൈൻഡ് ഓഫ് വർക്ക് ആയിരുന്നു. ഇവിടെ വരുമ്പോഴേക്കും പോസ്റ്റ് സെക്കൻഡറി ആകുമ്പോഴേക്കും കൂടുതൽ ഇൻഡിപെൻഡൻറ്റ് വർക്ക് വരും. അത് നാട്ടിലും വരുമായിരിക്കും. ഇവിടെ വരുമ്പം ഹോൾ ന്യൂ സിസ്റ്റം, അതിൽ ഇങ്ങനെ നാവിഗേറ്റ് ചെയ്യാന്ന് പറഞ്ഞാൽ it's much more harder. So you got the weather, you got the language issue, then you got the educational system, money issue, പിന്നെ ഒരുപാട് പ്രഷർ നാട്ടിൽ നിന്ന് ഒരുപാട് റെസ്പോൺസിബിലിറ്റി ഉണ്ടാവും. ഒരു മദറെ ഞാൻ കോഴിക്കോട്ടുള്ളപ്പോൾ അവർ പറഞ്ഞു എൻ്റെ പിന്നെ മകനെ ഞാൻ ഇംഗ്ലണ്ടിലേക്കാണ് വിടുന്നത്, കാരണം കാനഡയിൽ വരുമ്പോഴേക്കും ഒരുപാട് ലക്ഷങ്ങളാവുന്നുണ്ട്, അപ്പോൾ പറമ്പൊക്കെ വിറ്റിട്ടാണ് അവരിങ്ങോട്ട് പറഞ്ഞു വയ്ക്കുന്നത്. ഒരാൾ പറഞ്ഞു ഞാൻ 1 കോടി രൂപ ബാങ്കിൽ നിന്ന് എനിക്ക് ലോണ് കിട്ടി, ബിക്കോസ് ഹി വാസ് എ ലിറ്റിൽ ബിറ്റ് മോർ റിച്ചർ സൈഡ്. എന്നാലും ഈ കുട്ടികൾക്കും അവർ പാരൻസിനെ ഡിപ്പെൻഡ് ചെയ്ത് ജീവിക്കാൻ അങ്ങനെ ആഗ്രഹം ഉണ്ടാവില്ല. അപ്പം അങ്ങനെയുള്ള പലതരം പ്രഷേഴ്സ്, അത് ചിലത് അവർക്ക് പറയാൻ പറ്റില്ല എന്ന് വരും. പിന്നെ ഇവിടുത്തെ ലോൺലിനെസ്സും സോഷ്യൽ ഐസൊലേഷനും, അത് പിന്നെ you know what is that like when you're socially isolated. പിന്നെ വേറെ ചാലഞ്ചസ് ഐഡന്റിഫൈ ചെയ്തിരിക്കുന്നത് കമ്മ്യൂണിറ്റി റിസോഴ്സ്, നമുക്ക് എവിടെയാ പോകേണ്ടത് ഈ സപ്പോർട്ടിനൊന്നും, എവിടെയാ എങ്ങനെയാ കണക്ട് ചെയ്യാന്നുള്ളതും ഒരുപാട് പേർക്ക് അറിയില്ല. അതൊക്കെ നമ്മൾ പിന്നെ ഹൗ ക്യാൻ വി ഹെൽപ്പ് ദീസ് പീപ്പിൾ, ബിക്കോസ് ദിസ് ഇസ് സോ ഗുഡ് ഫോർ കാനഡ, ദിസ് ഇസ് ഗുഡ് ഫോർ ഇന്ത്യ, ഗുഡ് ഫോർ അവർ പീപ്പിൾ, ആൻഡ് വി നീഡ് ടു ഹെൽപ്പ് ഈച്ച് അതർ. പിന്നെ ഈ ബുള്ളിയും ഡിസ്ക്രിമിനേഷൻ അത് ഇടയ്ക്ക് ചിലർക്കൊക്കെ ഒരുപാട് അനുഭവപ്പെടും, ചിലർക്ക് അത്രയ്ക്ക് അനുഭവപ്പെടില്ല. പിന്നെ ചിലർക്ക് അറിയില്ല അതെങ്ങനെയാണ് മാനേജ് ചെയ്യാന്നുള്ളത്. പിന്നെ വേറെ ഒന്ന് കണ്ടിരിക്കുന്നത്, ചിലർ ഈ പിന്നെ വീടുകൾ താമസിക്കുന്നത് വളരെ ക്രൗഡഡ് ആയിരിക്കും. പിന്നെ ഇപ്പം 2 ബെഡ്റൂം ഉള്ളിടത്ത് ചിലപ്പോൾ 8-10 പേരായിരിക്കും താമസിക്കുന്നത്. അങ്ങനെയുള്ള സിറ്റുവേഷൻ ഒക്കെ പ്രഷറും സ്ട്രെസ്സും കൂടി ഉള്ളപ്പം ഭയങ്കര പ്രയാസമായിരിക്കും. അപ്പൊ അങ്ങനെയുള്ളത്. പിന്നെ ഹോം സിക്ക് ആവും. പിന്നെ you can just go to Paramount to eat food, or you can pick up your dad's car or take the bike, and all that fun is very different when you come here. പിന്നെ ഒരു കുട്ടി ഞാൻ പോയി കണ്ടു, ടൊറാൻഡോയിൽ താമസിക്കായിരുന്നു, ഒരു ബേസ്മെന്റ് അപ്പാർട്ട്മെന്റ്. ഇറ്റ് വാസ് സോ ഫിൽത്തി ആൻഡ് ഒരു ഡോഗ് നെക്സ്റ്റ് ഡോർ ഉണ്ട്, ഷി ഡിഡ് നോട്ട്, പക്ഷെ ഷി കുഡ്ന്റ് അഫോർഡ്, വേറെ ഒന്നും അഫോർഡ് ചെയ്യാൻ പറ്റുന്നില്ല. പക്ഷെ അവൾ എന്നെ കാണിച്ചു തന്നു അവളെ വീടും നാട്ടിലുള്ള വീടും, how she lived and what kind of work she had, and she left all that and come here, and now how she's going to tell family ഇത് ഇവിടെ കടിച്ചു പിടിച്ച് നിന്ന് എങ്ങനെയെങ്കിലും she want to establish. അപ്പം ഞങ്ങൾ കുറേ സംസാരിച്ചു കഴിഞ്ഞപ്പോൾ then she said, she was at the point, she says, I want to give up, I don't want to tell anybody, I almost feel like I wish I died. And almost like she was talking about suicidal thoughts, and that's the reason why I got involved with her. She found her light at the end of the tunnel. We were able to work through some of those things, and she's doing really fine now. Living with the guilt, we talked about the parents are expecting a lot, and we expect ourselves a lot, that we won't, it's nobody wants to say how things are failing or not working, and it's not really failing. It's just the tough time, and we got a COVID on top of it. So sometimes you think it's falling apart, but it's not actually falling apart. Because a person called me and said, Subaida, I hated that job that I was doing. Maybe COVID did something good to me. Now I'm thinking about starting that business I always wanted to do. Can you help me to go over this business, proposal that he was writing? And, let's look at that plan and stuff like that. Or people call me and say, oh, so nice. Finally, I can sit home for a while and focus on these things, So there is some other things, some creativity coming. Sometimes when the resources are readily there, you don't think about it. When, ചിലപ്പം രാവിലെ പറയും, ഓ ഉമ്മ എനിക്ക് പിട്ട് വേണ്ട, എനിക്ക് പിസ്സ മതി, എനിക്ക് ബർഗർ മതി. ഇവിടെ ഇപ്പൊ ബർഗറും പിസ്സയും തിന്നും മതിയായിട്ടിരിക്കുക ഓരോരുത്തർ. അങ്ങനെ so it's not easy. പക്ഷെ then you'll find, okay, maybe I need to start cooking. അപ്പോൾ പലരും പല ഡിഷസും കുക്ക് ചെയ്യാനും സ്വന്തം ഇൻഡിപെൻഡന്റ് ആയിട്ട് ജീവിക്കാനും ഒക്കെ പഠിക്കാൻ തുടങ്ങി. So there's a lot of everything may not be falling apart. Maybe things are falling into place, and maybe you getting your dreams, coming a reality, and working on it. So other times, then you think sometimes, people say, I don't know whether I want to cry or laugh, at my situation. So life gets so screwed up sometimes, and say, why? Like, I did all these work to come to Canada. Finally, I got it, and here I am. And why this COVID came at this time, So do you laugh or do you cry? So I'll say, enjoy the roller coaster ride. Life is a roller coaster, and enjoy the ride. So this time I'm going to turn to Muhammed for the next slide.
Can everyone hear me?
Yes, Muhammad, we can.
Okay, perfect. Now, before I go on to this slide talking about mental health, I do want to talk about a couple of points that Miss Hanifa had pointed out. Coming from India, which is such a family-oriented type of place and environment, when we come to an area like Canada, and a lot of students and a lot of the individuals who are taking jobs or going into colleges or universities here, they don't know exactly where they're going to end up. So if your college is somewhere in, like, say, Sudbury or Brockville or even sometimes Ottawa, those types of places where there aren't as large of an Indian/South Asian community, the loneliness and the feeling out of sorts feeling is that much more. So that's one thing to kind of consider when it comes to when we're talking about some of the stressors. But before talking about stressors, we need to really know what mental health is and how to cope with stressors, because that is part of our mental health. And really, essentially, mental health means striking a balance in all aspects of your life, which includes our social, physical, spiritual, economical, but very importantly, our mental. And it's a balance. It's a balance between all of these different processes and these different aspects of our life that really gives us the equilibrium that we're looking for. At times, you may tip the balance too much in one direction, and what that basically means is, do we have situational crises? We have different stresses and different things that happen to us that really kind of test us. And what it does is there are so many varying degrees of how something like this happens, right? It could be something as small as your coffee spilling on you, or for those of you who are in Canada, know our beloved 401 and our GBP. It's very, very situational stressors, but nonetheless, it does seem to throw you off your balance. Because one thing some people may have heard or some people may have noticed is when something wrong happens at the very beginning of the day, it really starts to snowball and makes the rest of the day really feel like worse than it really is. But what we really need to do is strike a balance. And yet the balance itself that you bring to the table is unique. And the challenges that you will face will be unique in itself as well. So what we're trying to say is the solution at the end of the day will be unique as well, right? It's not one size fits all. It is tailored to all individuals. We can go to the next slide. Perfect. Now, when we talk about stress is an actual autonomic response, right? So something negative happens, and the body's response to it can be something like what we've listed here, but it's not limited to that. Something like emotional exhaustion, increased irritability. I know that's me sometimes, and my wife can attest to that. Sleep disturbances. We get angry a lot. You know what? At the same time, we also sometimes get really sad, or we get recluse, and we just kind of want to hide from the world. And sometimes some pent-up feeling, and sometimes the guilt and the shame starts to take over. And it could be something that is not for the specific situation that it is, but it could be just the overall stress itself that's manifesting into the feelings that you're getting. Now, one of the things that really kind of happens because of stress is displaced anger. And what we really tend to do sometimes is, even though we are not specifically mad at a person or at a group of individuals, something else that happened really kind of, the person takes their anger out on you. And this could be another stress response, and which is really why we need that good supports within our life that can be the ones that we can really vent to or we can really talk to. Next. Now, when we talk about stress and the sources of stress, like I mentioned before, there's so many different things that can be. This is just a little diagram that shows, okay, you know what? An individual can have varying degrees of stress, the conflict, cataclysmic events, death. Maybe they didn't get the job that they wanted. Maybe the conversation with their superior didn't go as well as it did. Maybe you didn't get approved for that mortgage. Maybe, you know what, the lineup for our grocery stores nowadays are an extreme source of stress, considering it's going to be a 45-minute lineup in the wind and the cold, but you have no option, right? You have absolutely no control of it. And that is one thing I do want you guys to remember, the word control. We really need to step back and think, okay, you know what? Do I have control of this situation? And do I have control of my behaviors and my output? And that's really something that Ms. Hanifa here is going to be talking about later, as to how we can really change our mentality as to how we deal with stress and how we see it. The next slide is kind of talking about how it could be manifested. So in our body itself, it can come out as physical symptoms. Now, headaches, frequent infections, fatigue, scare, these are things that really the body responds to when it comes to stress. One of the things that's not written here, but it is very, very real, is weight loss or weight increase. A lot of people like to stress eat. A lot of people really don't like to eat at all in the times of stress. So again, it's very, very unique to the individual. It's just a matter of you understanding what your stressors are and how it's manifesting, and so that we can really tackle it one by one. Because some of the behaviors and emotions that really kind of comes out is the things, as you can see here, it's irritability, it's depression, apathy, meaning like there's lack of care. We're always worrying, we're always kind of negative. You automatically start becoming known as a person who is a pessimist rather than an optimist. And again, the behaviors and some of the physical symptoms that really comes out affects more than just you. So we do want to be cognizant of that.
This is the slide I'm going to talk about it, right?
Yes.
Okay. This is like a slide, this is also a tool for you. I want you to kind of pay attention to this one because you can take it home and work with it. Because often, like people like me and Muhammad, when we meet people in crisis, what they're coming in for, like usually with a panic attack, and they think they have a heart attack, or maybe they have something wrong with my brain, and maybe I'm getting a tumor in my brain, and that's how they feel. I can't sleep. I lost my job, and you know, it's just like everything is getting to me, and I just don't know. Maybe something medical, and sometimes they go through a whole pile of medical diagnoses, you know, testing and all that to make sure that it's not anything to do with their heart or brain. So when you sit with them and talk about it, like, and usually most of the time there's another person coming with them, it could be a mom or a wife or a sister, and they usually say, he's been going through that for a long time. We need to get to the bottom of things, you know, get to the bottom, you know. And so I need to kind of take time, like I can tell you an example of a nursing student, like not a nursing student, like I was a university student in science, and she was, it was a dream to complete her PhD. She said she was so depressed she couldn't sleep, she had increasingly anxiety. When we start talking about it, there were many layers of things that she was dealing with. She was raped at age 17, and she was living with it for a long time. Anything that happened in your past, any kind of abuse or death or loss, that comes out when you're vulnerable. So then we sat together, and I said, which one you want to deal with? And sometimes, you know, people come and say, I can't stand my mother-in-law. She's been annoying me for the last 25 years. And that's been the bottom of their stress or something like that. And so I'll say, let's sit down, like, let's prioritize, let's list all your stuff. So when you're coming with a lost job, and mom got diagnosed with cancer last week, my daughter is graduating next month, I need to think about how she's going to go. And I went to the doctor, and he said my cholesterol is high, and my sugar is showing up, and I don't know, my heart is different. I think there's something wrong with it. My son is now with the wrong crowd. What am I going to do? So it's like piling up on them, overwhelmed. So the job that we do, like people like me and Muhammad, sit with them, make a list of things. And these are kind of things you can also, when take a deep breath, we'll talk about the breathing. Again, this is not the type of breathing we're talking about in COVID. This is for the anxiety breathing, is very different. We'll talk about that like later. So like, you need to really calm down and sit down or sit with somebody and write those things down. Sometimes I say prioritizing. Sometimes people cannot prioritize. They say, well, this is happening simultaneously, 3 events happening. My mom really need to get to the hospital today for the treatment. I'm the only one who can drive her, and my car is not even working. And so that sort of stuff. So we kind of say, okay, you don't need to. We just list things. We don't have to put numbers on it. Then we'll pick, and maybe next week, what we made the list, maybe something else need to come up on top. So sitting down and writing down, making that list, and say how soon we have to deal with it. your mother-in-law been annoying you for the last 25 years. Can she wait for 2 more days so you can get your sleep under control? And so people agreed to work with me on next 24 hours, next 48 hours this week. And then we'll get to the next level of that issue. Then you'll be strong enough to even to address that issue. Then you can take your daughter for shopping for that graduation, dress or whatever. So soon they will find out how we're going to do that. And then we come into that strategy and the planning and writing it down. And often I ask people, who can help you? I have no one. And that's a lot of times we get that, I have no one to help. I don't know where to turn. And there's nobody on earth with no one in their life. And I'll say, oh, so you said you went to the doctor and you have a health issue. So you have a family physician? Well, can we put that, make it that on the list? Yeah. Your daughter, did she talk to the school guidance counselor about her, entering the university? Yes. Why don't we make her on that list? So at the end of the day, they'll find a neighbor, there's a friend that they can say a little bit or this, or maybe somebody's there to drive the mom to the hospital. So at the end of that session, they made a whole list of things, and that's their team. So here's your priorities, you listed everything, and you also time frame it like, okay, I need to deal with this today. Next one, I can put it off for a week. I don't need to think about that. I need to get my sleep today. I'm going to focus only on my sleep and getting my panic attacks down. And so we teach the breathing and we work on those kind of things. And as soon as we kind of start doing that, this part of it, automatically people are more stronger and they know how to deal with that. And some of them, they say, well, I'm not worried about that. So that's when you also make a safety plan, because sometimes it's not that simple. Some people say, I can't, I just feel so hopeless. Sometimes the stress, if we didn't watch the stress, it's like if you didn't attend a simple cold, it can become a bronchitis and pneumonia and everything else. So why we stop, we want to stop at the stress level. In this session, we're not talking about the disorders and illnesses. We're talking about just the stress and some anxiety come with it. So we're not talking about all the disorders and illness. We don't want to get there. If we get there, we know how to take care of that too. And that'll be a whole different session. So a safety plan should have all these numbers. And so there's your kind of, then when people are really stressed out, you don't know where to, I can't find my key and, I can't, I don't know where I put this one, and you're yelling at somebody. And so once you have that list, whether it's a list written down on a piece of paper, sometimes I say, please write it on a piece of paper, because often people forget to charge their phone or they don't have the range. Otherwise, you can keep that also on the phone, so it is digitally available to you. So moving on to the next slide. Now, any of these things, like if you have questions, we'll answer to that. This is another tool that I came up with, because people usually say, I have a son with, oh, my husband is diabetic, or my wife is, like a disease, like a diabetic. Why would you say, he's not just a diabetic, he's also a person who can, who is a great swimmer, maybe he's, great at his tool and die job. And, so there's a person has a lot more than just a disease. So when you look at this, look at the ADHD kid, might have a reading disorder, writing expression, have a difficulty, acute anxiety, but he works very hard to keep up his grades. He has lots of good friends. He's a great swimmer. And he's a, singer or a keyboard player. But then also outside of that, my grandmother has cancer. He was very close to grandma. So people are not just like a disease. They have a lot of things going all around them. And they also are very good at so many things, right? So we need to think of a person as a person with a lot of positive stuff. And then having some illness is only just a part of you. Why I say that is, when you strengthen the strong part of that person, that itself is the best thing. That you improve their self-esteem. You say, well, I have diabetes, but that's not I'm also, I'm a great person. I'm a great accountant. I'm a great doctor. I'm a great nurse. I'm a good grandmother. So you want to put the positive into people's lives. So that's the next slide. You can also kind of draw that out and say, okay, this is the problem that I have in the middle, but I have a lot of other things. I have good friends. I'm a good cook, and take pride in keeping my house clean or whatever. So make it like expanded. So that's a tool that you can write down and kind of look at in a different way. Now this slide is for you,
Yeah.
Ahmed.
So when we look at everything that's kind of happening when it comes to COVID, and it goes back to what I was saying as to what are things that we can control and what are the things that we cannot, right? So COVID, yes, it hit a lot of us very, very hard when it comes to financially, when it comes to physically, when it comes to our routines. But one thing I want everyone to remember is this is something it's affecting almost everybody, right? It doesn't matter where you're from. At the end of the day, and it doesn't matter what you do, it's really putting a toll on us entirely as a society. And so what we really want to look at is solutions for recharging. And COVID is everywhere right now, right? ഏത് ന്യൂസിൽ നോക്കിയാലും കോവിഡാണ്. ഏത് ആൾക്കാർ നോക്കിയാലും വർത്താനം പറയുമ്പോൾ എല്ലാവരും കോവിഡിനെ പറ്റിയാണ് വർത്താനം പറയുന്നത്. That's why we really want to take a little bit of a break, because it's a little bit of an alarmist type of theory, and it's people really thinking the negative and the worst. Take it from somebody who's still working in healthcare, and I'm in long-term care, and I'm seeing the effects of what's happening with COVID-19. And trust me when I say I need a break quite often, because just hearing about it is really going to make you feel worse than it really is. The other thing is set goals and plan daily routines. Now, I know your routines have been affected. So you might be an individual who got up at 7 o'clock, was out the door by 8 o'clock, went to work by 8:30, got home by 4:30, whatever it may be. Have new routines for yourself, right? If you are confined to your home, try and do things productive around the house. One person who's really good to ask about that would be my dad, Brian Kurikkal, our Kmcc president there, chair there. Every single day he's finding something new to do, and every single day he plans and he keeps himself engaged and he keeps himself busy. And so getting yourself to have almost like a routine of doing something really kind of helps you get back into a little bit of normalcy. And the other thing that you really want to focus on is if you feel like you're going cabin fever and you're going stir crazy, right? At the end of the day, especially here in Canada, I don't want to speak out of turn when it comes to UAE, and I'm not sure what it's like in the UK, but in Canada, luckily there's no full lockdown. So if you feel like you want to go for a walk and you really want to just take a break from everything, feel some fresh air, absolutely go ahead and do something like that. You want to find healthy activities that you really kind of enjoy. Or, you know what, at the end of the day, it's very unique for us in the South Asian community because, again, we are so familial. We are used to having our family come to the house all the time and eating together and talking all the time. So maybe, even though we can't physically be close to them, at least we can hear their voice, call them, call our friends, reach out to a neighbor, make video calls, whatever it may be, that makes you feel a little bit less lonely and make you feel like, okay, you know what, this is something that I can kind of get through. Now, next slide. Some of the avenues that I really, really want you to explore, because they're, as I said earlier, this is not going to be a cookie cutter solution for all, right? And different people have different stressors. So if you are a student and you are going through some financial trouble, I do know, especially being a student here, there are a lot of financial aids and a lot of different emotional and psychological supports that the different schools can definitely connect you to. They may not be open and running when it comes to actual physical, but their back offices, a lot of them are still running. Many of the community-based programs that help, so the shelters, the food programs, the cultural associations, like KMCC and those types of things. If you feel like you need help, if you feel like you need to touch base with somebody, reaching out to any of these avenues is definitely one of the solutions. The religious institutions, I just saw in the news yesterday that the downtown mosques are offering people food and offering people um, almost like sessions that they can go and express their feelings, and because we don't have tarawih anymore, because we don't have people that's communing together, a lot of these institutions are really reaching out to people in other avenues. The last thing I'm really going to say when it comes to avenues to explore is everyone kind of needs to have a go-to person. That go-to person is whether they're in the same country as you or they're in a different country. We're living in a technological marvelous world. So connecting is definitely not an issue. But you definitely want somebody who you feel like you can say anything and everything to. And it's a place where you don't get judged. It's a place where you feel like, okay, you know what, you're at ease, but you definitely want to have that person. If you feel like you don't have that person, as Ms. Hanifa said, there's always somebody that we can kind of rely on, right? And just reaching out to that person and really having a conversation with them is just not going to hurt. Next. Now, some little but very effective things that you can really do when it comes to self-care are very little things like eating healthy. Because what you eat really is how you feel. If you eat like crap, you're going to feel like crap. Getting adequate sleep and rest, physical activity, so going for a walk, maybe in-home yoga, whatever it may be, that really kind of gets the heart pumping a little bit, would be good for you. Now, the one that says practice deep breathing, it's a little bit different than what we do on a normal basis in order to just live. Right? There are several different breathing techniques that they show us here in mental health, but one of the most effective ones that I've found, because when you start getting anxiety, when you start stressing, what you really start feeling is your heart, you can feel it in your throat. You can feel the palpitations. You have obsessive thoughts and you start sweating up, and it's a lot of automatic responses by the body. But it's actually been studied and proven, by controlling your breathing, you're actually going to be able to control that loss of control. Okay? And one of the most effective ones that I found is the square breathing. And essentially, it's actually quite easy. And what I'm going to do is I'm actually going to try and practice it with you guys. I know I can't see any of you, but what square breathing basically means is we take 5 seconds for each of the steps. Now, the first step is inhaling. We take 5 seconds to actually inhale. 5 seconds, we hold the breath. 5 seconds to exhale. And then 5 seconds before we start the next breath. We do that a few times, and the body actually automatically starts controlling itself. So what I do want us to do is actually do want to try this, okay? So what I want everyone to do is take a nice deep breath. 5 seconds in. Hold. Five seconds out. And 5 seconds to refresh. This is one of the points that many patients who come in with anxiety attacks, anger attacks, being in the emergency psychiatry world, being in the forensic world, I found this to be quite effective for a lot of individuals, especially for those who feel like things are going out of control. So it's a form of relaxation. It's really kind of calming your mind. But the other things that you really want to be cognizant of is your time management and your financial management. Yes, it's hard times. Yes, there are things that are out of your control, but what you can't control is the output itself. So, for example, with financial management, one of the biggest things, knowing that you're in a little bit of a tight spot, is budgeting. Seeing where you can sacrifice certain things, certain, I guess, luxuries, and really kind of looking at the bottom dollar and looking at the bottom line. Say, time management, looking at, okay, you know, if you feel like you have too much time on your hand, how can you fill that time? Or if you feel like you don't have enough time, how can you, what are things that you can take away in order to really kind of make yourself feel much more relaxed? Next.
So this is the slide that I will be talking from. Most of you probably heard about cognitive behavioral therapy. This is like, you don't need to learn the whole therapy. At least you get the idea of what that means. It's a very simple but valuable tool that you can take it home and think about it. It's like talking about how thoughts and emotions and behaviors are connected. An event can trigger your thought, and then that thought will create emotions in us, and that emotions then turn into, you know, how we behave. So the next slide I can show you, like, let's say, you know, Muhammad, told his new wife, he is the only wife, right? And said that we're going to have a dinner. And this is the third time they were trying to get to go to a nice restaurant and have some food. And he said, yes, I'll be there and I'll be on time. And here she was waiting and waiting. And she said, oh no, he's not here. Now he must be talking to those nurses at the hospital. And, you know, of course that is, you know what kind of feelings that comes, and angry. And this third time, I'm not going with him again anymore. And, you know, so it just get very, very upset about it. And then what happened, like when Muhammad comes to the door, she's revising, oh, it's about time you showed up, and, you know, that sort of reaction. Let's change that thought now. Let's change that thought. And then, you know, what happens really happening is Muhammad was called in to do some other work, and he got an emergency that came up, and he's a manager and he need to address that before he leave the building. He's struggling with it. Oh my God, you know, how am I gonna, I can't even call her right now. And so he's dealing with the emergency. He says, I gotta buy her some flowers on my way, and he's taking the flowers to the door. And just think about those feelings when, you know, you come there. Now we're trying to change his wife's thinking and say, maybe, I hope he's not in an accident. I hope the, you know, highway wasn't so busy, he's not stuck. So you see that kind of thought again changed the feeling. I hope he's okay, he's concerned. Her actions may be different. He may be calling all over the place. Did he leave the hospital? Where is he? You know, like, so that kind of stuff. Same thing, we could take another scenario. People go for a job interview, and, you know, you bought your best suit, and, you know, you prepared to death to go for this job, and this is your dream job, the first job you want to get. And you go through the interview, you didn't get the job. So you come home, you can think in different ways. So that, you know, okay, I didn't get the job, I will never, ever get the job. The thinking might change into that negative thinking and say, I'll never get a job. I tried this so many times. Then your feelings are like, I'm not going to try again. And then your actions can be, you know, okay, like, I want to cope. And if you're accessing a negative coping strategy, that'll be like, okay, maybe I'm going to have a drink. And I'm not talking about masala tea. You know what I'm talking about. It's not slave money. So we need to also, I know in our community, some of us, you know, hesitate to talk about the substance use, you know, alcohol, drugs, which is the reality that Muhammad and I see that. So I want to put that out there. That's not a good way to go. And also, and I'm not lecturing you, but we do see, and it's not your fault because you just want to, you know, just when you're stressed, you want to hang on to something, right? What's available. The other thing, like people also don't talk about in our community is suicide. And we both are not afraid to talk about them, and we want to talk about them. I want to mention it, but this session, we didn't talk about the illness and disorders and all that deep stuff that we could have other sessions for that. So I just want to mention that out there. So let's say the person who didn't get the job now, changing his thinking, you know, I'll say, well, you didn't get the job, but how many people applied for that job? There was only 2 positions and 1,000 people were, you know, applying for it. And could it be that, that maybe, you know, like there were so many good candidates like you and it was difficult to choose? How about thinking about maybe changing your strategy, or maybe changing, you know, maybe you want to update your education, or maybe apply again, you know, maybe the, you know, enough room to come in. Thinking changes. But if you start saying, some people come to me and say, I didn't get the job because I'm brown, that's like you're putting you into a brick wall, right? Because your color is going to be always brown. And, like unless you, bleach or something, I don't know. but we are brown, we're Indians. That's not a reason not always not to get a job. These are, kind of feelings that comes to you and say, and you can't go anywhere. You can't do that. What can you do? You can go and learn how to do an interview. You can learn, maybe I didn't do well in that area because I didn't look at the company's, job description, or maybe I could improve. Maybe I can talk to somebody about improving it. Your actions will change because you want to go back to school, or maybe you want to talk to somebody, maybe you want to update your resume. So you can see how things are changing. So this is a good tool for you to think about it, how your thoughts and feelings and actions are connected, and how you can change the negative thoughts into challenge. Maybe that's one reason. Maybe Mama is talking to some nurses and hanging out there. But how about challenge with another thought? Like that could be one reason. But what if he stuck in the traffic? What if he called into an emergency? So the feelings changes and your actions changes. Next slide. You want to talk about that?
Sure. Now, again, these are resources that we're really kind of familiar with. So again, if you are from outside of Canada, there are different emergency and crisis lines that are available to you guys as well. That can be universal in the fact that there's crisis lines everywhere. Telehealth is here in Canada, and really all of it's immediate and it's confidential. There are numbers like 211 and 411 here in Canada that really kind of sets you to that really kind of sets you up to do whatever you need. Now, if you do get into a medical emergency, then at the end of the day, what you need to do is call 911 or however you access the emergency line. We can go to the last couple of slides, just because I do believe we're running out of time.
Yeah.
Now, the one thing that I really want to highlight here is I just want everyone to remember, especially when it comes to this COVID and the stressors that COVID has brought, it is temporary. There is a light at the end of the tunnel. As we speak, many cities and activities are gradually opening up, or they're talking about opening up. And social distancing, though it should be maintained, and with lenience and restrictions from authorities, that normalcy will return. And my guess, just coming from a healthcare perspective, I do think it's going to be sooner rather than later. Now, just the last couple of slides are just some of the resources, and from what I understand, these are going to be available to you guys when it comes to the PowerPoint. So if you guys do get a chance to take a look at some of the resources, and there are some great reads, or there are some great hotlines that you can really kind of go and speak to somebody if you do need something further. Now,
these slides will be available to you, and we also want to mention some of the resources are like really good for you to even review, and rely on the good, reliable sources for your learning facts.
Mm-hmm.
And we want to thank you for the opportunity to work with you. It was a pleasure. And I also want to thank the organizers. They were the awesome team to work with. It was wonderful. They made it very easy for us to present this to you. Thank you. And there is
very
light at the end.
Oh, thank you, ma'am. That was a very enlightening, precise, well presented, and a lot of informative stuff in a nutshell. I take this opportunity to wholeheartedly thank both of our speakers for today. Indeed, it was a very learning experience for all of us. We are actually in short of time, so I think we'll have to brush up to the question session. We can have a brief question area wherein all of you can come up with your questions. നിങ്ങൾക്ക് എന്തെങ്കിലും ക്വയറി ഉണ്ടെങ്കിൽ ഈ ഒരു ടോപ്പിക്കിനെ സംബന്ധിച്ച് എന്തെങ്കിലും ക്വസ്റ്റ്യൻസ് ഉണ്ടെങ്കിൽ മുന്നോട്ട് വരാം. നമ്മൾ എക്സ്പേർട്സിനോട് ക്വസ്റ്റ്യൻസ് ചോദിച്ച് നിങ്ങളുടെ ഡൗട്ട്സ് ഒക്കെ ക്ലിയർ ചെയ്യാം. സോ ദിസ് ഫോറം ഇസ് ഓപ്പൺ ടു ക്വസ്റ്റ്യൻസ്. Anybody has any questions, kindly come forward. I believe nobody has actually come forward. We are very fortunate to have received certain questions in hand via our WhatsApp service. So I'll just put forth a few questions, and I believe the questions have been asked by mainly students and newcomers. So I think it will be of great help if our experts answer them. I'll just move on to the question that we have received. A female international student, her roommate got a job in a healthcare setting recently. This student has an existing respiratory illness. She is really stressed out, worrying that she may get COVID-19 through her roommate. Any advice that you would give?
Now, the one thing I do want to put a lot of people's mind at ease is just because you're working at the hospital, a lot of the hospitals and a lot of the healthcare settings are requiring and making it mandatory for individuals, even when they're walking through the hallways or in patient care areas, to be fully protected. Now, that includes the gowns, the masks, the face shields, the gloves, everything, right? And proper hand hygiene at the end of the day is what's really important. I can understand where the fear and the anxiety is coming from, just because this person is in an area where there could be a concentrated amount of COVID type patients. But really, as long as this individual is communicating to her roommate that they really do feel and make sure that she does practice proper hand hygiene, and I don't know, maybe even suggest possibly taking a shower or whatever it may be before even having any kind of interactions, because I know that's what I do. Pretty much all day I'm in an area where it's COVID everywhere, and so what I do is, again, I do my proper protocols at work, and then when I come home, I make sure that I put everything away to be laundried or to be washed, and I take a shower just so that there is no risk and no chance, right? But that's an open conversation that this individual does need to have with the roommate. And the roommate, if she is in a healthcare setting, will completely understand. It's not going to come off as something that's negative. It's really just going to come off as, you know what, I understand where this person is coming from, especially from what this person is seeing, if they are seeing the same things as me. Anything to add, Ms. Hanifa?
That's it. Yeah, you did a great job.
Okay, we have a very genuine question from a newcomer, which says, any suggestions for this recently immigrated family who has never got a chance to work or doesn't have much social contact to prepare mentally for future job interviews post-lockdown?
So the one thing that I would really suggest is, like I said in the slides, is reach out to our communities and so if you're on this forum, then you're definitely somebody who knows somebody who's with Kmcc or one of our other organizations, right? So reaching out to individuals, because networking is one of the most effective ways of getting your name and getting any kind of opportunity out here, especially in Canada, I find anyways. So reaching out to an individual to within these organizations to really kind of get help is, I think, one of the most effective ways when it comes to not just for a job, but for a sense of familial, a sense of friendship, and to really have some contacts out there.
So maybe I can step in there too and say, we're talking about integrating to the new community, the new country, the new culture, the new food. There are tons of resources available, and I actually gave you some of the resources there for specifically for multicultural community and the newcomers. Many organizations are there to help you, to prepare you for your resume, your interview, and how to do that. We all do that too, to help people how to prepare for it, and how to even mentally get prepared for it, and how to dress, to how to put your foot down when you sitting for the interview, like a personal or professional. All kinds of resources are available. Now, I know we have audience from all over the different countries, and they probably have different kind of format. We can find that for them, or they can discover and find that for themselves. And it may be very different too. Going for an interview in Canada may be very different than when you go for a job in India or UK or UAE or other places. But there are lots of organizations. I gave a lot of resources. If they can't find that, I can give that to the organizers. Not a problem.
Okay, thank you so much. Actually, we have got a few other random questions as well, but I'm extremely sorry to say that we have very less time and we are towards the end of winding up the session. I would like to take the opportunity to welcome Jan to present the vote of thanks.
Thank you for attending this great session. So we all know that this COVID-19, so we are not only like financially, we are not only financially, like emotionally, we all are in very big struggle at this moment. I personally, not only personally, I believe that this session is a great to everybody, especially our international students and newcomers. So we hope that you found the session informative and worthwhile. We Kmcc and TLM are pleased to have your participation in this outstanding conference. And we thank you for your valuable contribution, especially our speakers. They have contributed their valuable time with us. Thank you so much.
Now, one thing I do want to add is if there are individuals who don't feel like talking in an open forum and do want to reach out to either Ms. Hanifa or myself to ask specific questions or to kind of get them connected, then the organizers do have the ability to give the contact information so that we can have a conversation with you outside of this.
Okay, very well, thank you. So we now wind up our session. If there are any personal kind of questions, you may please contact our guest speakers, or if that is not possible, you may contact KMCC or TLM for further clarifications. It was great having you all on live, and thank you so much. We all look forward to having more sessions like this. Very well, thank you.
Thank you.
Thank you so much.
Thank you, guys.